My talk is on early identification and management of subluxated cataract. It is not moving. Yes. Now it is moving, madam. My slide is
yes.
So subluxation of lens makes every step of cataract surgery difficult. So it requires early recognition of threatening sign and meticulous management of same for better outcome. So early recognition minimizes further worsening of complication, reduces surgical duration, early rehabilitation, and good visual recovery. So preoperative workup is very important to identify it in a very early stage, preoperative stage. So detailed history and meticulous slit lamp examination and slit lamp findings like variable anterior chamber depth, vitreous in anterior chamber, iridophrecodinosis, or visibility of liquator of lens in eccentric gaze should be uh, captured in preoperative workup. So problems arises if subtle sign of subluxation are missed out in pre-op workup, or when you are working in a high volume setup where you have not seen the case pre-operatively, or there is intraoperative dialysis. So when before entry, you should look for variable anterior chamber depth, sphincter tear, or visibility of equatorial margin after proper dilatation. You can slightly tilt with forceps and see whether any dialysis is there or not. So sometimes just after entry, if you encounter with vitreous near section, it makes your surgery more difficult. And one can expect larger dialysis than what is seen. So first we have to clear the vitreous from the section. We have to swipe it from the section. And then after that, you can tamponade the dialyzed area with dispersive viscoelastic. Then you can go for automated vitrectomy to clear the vitreous, and then you can proceed further. In a few cases, just after staining your capsule with trypan blue and injecting viscoelastic, if you observe any stain is seeping in the vitreous cavity, means it indicates that your granules are weak in that area. So you have to be careful and you have to manage accordingly. And sometimes during Rhexis, when you have started Rhexis with sharp cystotome and you see puckering or dimpling of capsule, it indicates that there is generalized weakness of granules in this cataract. In few cases, if you have started your Rhexis and you are finding it difficult to initiate the Rhexis with the sharp needle, it indicates that there is a subluxation of lens. So you just make a nick and you can use capsule Rhexis forceps to complete the Rhexis without exerting excess pull on the granules. So if this type of case is identified early, then you can manage it by placing capsule hooks. Care should be taken that paracentesis should be made slightly posterior to limbus so that there is no pull on the Rhexis margin, and there should not be excess pull on the capsule when you are tightening the hooks. Sometimes you can use CTR preoperatively also, so that it will further stabilize your back and it will prevent further vitreous prolapse. And sometimes during Phaco, that due to surge, there will be chances of rupture of capsule. So it will prevent you during that time. In few cases, when like in dense pseudo exfoliation, if you have used Aris hooks for pupil expansion, and then during a Rhexis, you find there is gross subluxation. Then after completing Rhexis, you can transfer the same hooks, iris hooks, to the capsule to support your bag. If you are dealing with slightly harder cataract and you identified any genre dialysis in very early stage of phacoemulsification, then it is better to move to some other site and away from that your main incision, and you can convert it into a small incision cataract surgery, and you can prolapse and do your surgery safely. If you are dealing with some subluxated cataract and while cortex aspiration, you find that there is dehiscence in the journals or weakness in the bag. So instead of using a radial pull, you can use a tangential pull to pull out the cortex, so that it will prevent your further extension of journal dialysis. This type of bag can be stabilized with CTR ring after cortex was. So remember 3S, 3A's: be alert, know what to anticipate, and act quickly for a good outcome.